Does your skin look like this? Or have you seen skin like this? By the time we finish this video, you'll be able to recognize herpes zoster, sometimes called shingles. You'll be able to have an appreciation for how shingles relates the skin system to the nervous system. And of course, you'll learn some of the main treatment strategies that are involved. Shingles comes originally from having had chickenpox earlier as a child. For those of you that are like myself, you're old enough to have been around before the chickenpox vaccine was available. Many of us have had chickenpox skin infection as a child. It would have been very unusual for someone to have avoided chickenpox altogether if they've had no history of a chickenpox vaccine. So for those of us that had chickenpox as a child, what happens, of course, that we recognize that we broke out with chickenpox. We probably stayed home from school for a few days. As the skin infection heals, the virus actually travels back through the sensory nerves, all the way back to the spinal cord, and specifically the part of the spinal cord where sensory nerves take origin. And for many of us, like myself, who have never had the shingles vaccine, we are susceptible to the possibility of eventually at some point, not necessarily, but some of us will have that chickenpox virus that has been lying dormant in the spinal cord. It will travel back out through those sensory nerves, go all the way to the skin, and erupt again in the form of shingles, which is what we see in this video here today. So you can see that shingles kind of relates the skin to the nervous system. There are sensations all over our skin. There are sensory nerves that supply the skin from head to toe with sensation. And likewise, as I mentioned, there are specific parts of sensation that take origin from sensory nerves. These nerves take origin from the brain, the top of the spinal cord, all the way to the bottom of the spinal cord. It has been mapped out to show that specific parts or geography or surface areas on the skin correspond with specific parts of these sensory nerves. Those that are in the top portions of the body have sensory nerves that take origin from the brain or the top portions of the spinal cord, and vice versa. The ones that are from the lower portions of the body most likely take origin from sensory nerves in the lower parts of the spinal cord. These specific surface areas associated with their specific sensory nerves are called dermatomes. So think of a dermatome as a skin's representation of a corresponding part of the nervous system. So the dermatome that's represented in this specific example, you can see is really involving the upper 1/3 of the face. The cranial sensory nerve that innervates this upper 1/3 of the face takes origin pretty high on the brainstem, and it supplies this upper 1/3 of the face. You can see that it is related to the left side and it spares the right side. So this explains why shingles usually has this unilateral or observed on one side quality to it, while the opposite side often is normal. There are also physical signs that are associated with shingles that you can see. The crusting is probably the most important physical sign. But you can also find that shingles will erupt with tiny miniature vesicles or miniature blisters that can also be seen sometimes in some examples. I'm Dr. David Bryant. I'm the proud owner of World's Famous Dermatologist, a dermatology practice in Stockbridge in Decatur, Georgia. We help patients from all races and ethnic groups, but we're probably best known for our expertise in Black skin. The dermatologist that you go to and trust does not need to be a Black American like myself to be qualified to work on Black skin, but whoever you're trusting with these kind of conditions should have experience with a large volume of Black patients and be very experienced with skin conditions that affect darker skin types. I hope you enjoyed today's video. If you did, please like, comment, and subscribe to the channel. Please leave your comments below. I will consider your comments and questions the next time we cover similar content. I look forward to connecting with you on the next video.